With Dr. James Smith. He's a lecturer in Humanitarian Policy and Practice at University College London, as well as an emergency physician. Doctor, welcome to the program. So everything that you and other doctors and humanitarian groups warned about the GHF and how they were going to operate has very tragically come true since they started delivering aid. Why were these warnings not heeded by the United States and by Israel?
Absolutely. Everything that not only we, but at the highest possible level within the established humanitarian system, within the established UN system, everything that representatives of these agencies and organizations warned would happen has unfortunately played out with the most barbaric of consequences. The reason that Israel and the US and its other remaining allies have refused to listen to these warnings is that they very clearly want to maintain and exert complete control over the humanitarian system as another means of controlling the Palestinian population. If we look back over the course of the last 20 months of a spiraling genocide, Israel has repeatedly used the selective provision of humanitarian aid and the widespread deprivation of humanitarian aid, not only to maximize suffering, but also to ethnically cleanse the Palestinian people from Gaza, largely from the north towards the south, to this shrinking enclave in which the 2.1 million people are now being forced to live, to survive. So the reason they haven't, listened or taken heed of any of these warnings is because this system is functioning exactly as they had intended it to.
And it certainly has been a weaponization of aid, because the GHF at this point has 4 distribution points, nothing even in the north. The UN has about 400. Surely at this point one would think the UN has to be brought in or even allowed to help or to coordinate, given they're so well experienced in aid delivery in Gaza. And when you've got that many people, thousands who are starving, so desperate for anything, what sort of measures need to be put in place for aid to actually be delivered effectively?
Well, to answer your second question, I mean, the international community, or what's left of the international community, needs to take seriously their political, legal, and moral obligations, and to exert complete pressure now on the Israeli regime to bring about its genocide in Gaza. And one pillar of that genocide is the systematic deprivation of humanitarian aid, coupled with, of course, the destruction of life-saving infrastructure, including bakeries, hospitals, and so on. And then topped, of course, by the ongoing and brutal direct military violence, which continues to receive support from some of the most powerful states the world over, the US and the UK prime among them. What's needed is an immediate opening of the Rafah crossing, all other crossings that traverse the armistice line between Gaza and the state of Israel. The trucks are waiting. There are trucks literally on the other side of the armistice line and on the other side of the border with Egypt that are waiting to enter Gaza with the life-saving water, food, medical aid, and shelter equipment that is needed to save lives and offer some modicum of dignity for the Palestinian people.
And when it comes to that medical aid, that, of course, we know is so desperately needed. It was a year ago that you were in Gaza working in hospitals there, and you described it then as being beyond horrific, the conditions in hospital. If it was beyond horrific a year ago, what's it like now?
I mean, what we're talking about here is genocidal violence. How does one begin to describe to an audience that is watching, that is bearing witness from behind our TV screens, what this violence looks like, the way that it affects people, the impact that 20 consecutive months of violence has on a people, on a population, on healthcare workers who are treating day in and day out people that are suffering directly and indirectly as a result of Israel's violence. The health system is propped together simply by virtue of the sheer determination and commitment of the Palestinian health workforce, which unfortunately has adapted to work under the conditions of protracted occupation, and as such is able to work more efficiently under the conditions of the genocide and now this escalating siege. But the health system cannot, there is no health system in the world that can adequately function amid genocidal violence.
Absolutely. It's incredible how they're still managing to help those who need it. Dr. James Smith, appreciate your time and insight. Thank you very much.